we need vaccine mandates? These protesters in New York say it's their right to decide what goes into their body. And mandates for state employees and healthcare workers go too far. But in Europe, Italy has gone even further. From October 15, anyone wanting to participate in public life will have to be vaccinated or have recovered from a COVID infection. The penalty will be a hefty fine. Many are now asking whether these new rules are part of a trend that will lead to a global vaccine mandate. It could be the only way to beat the COVID pandemic.
Hi, I'm Ben Fazoulan. The number of coronavirus cases continues to rise in Greece, and now that schools have resumed following the summer break, the government's introduced tougher legislation aimed at persuading more people to get vaccinated.
It's lunchtime at this fish restaurant near Athens. Everyone who works here is vaccinated. The owner checked their vaccination certificates. Having all 8 of his employees inoculated is the only way his establishment could qualify as COVID-free and operate without restrictions. There was one employee who didn't want to get vaccinated at first, but when it essentially became mandatory, he did. It was the only way to keep his job. At first, the new rules only applied to workers in bars and restaurants. But now everyone has to inform employers of their status. Unvaccinated people have to be tested at least once a week at their own expense. Employers who do not enforce the rules can be fined up to 1,500 euros. Most support this policy. It protects us all. I think that it's crucial for the common good. I'm a teacher. How can I enter a class without being vaccinated? You just can't do that. The rules in the healthcare sector are especially strict. Those who refuse to get vaccinated have been put on unpaid leave. That has triggered protests and left many hospitals with a real problem. 40 of our 1,600 employees have been suspended. Unfortunately, that has a real impact because we have serious staff shortages. And that's true for almost all the hospitals in the country. At the biggest vaccination center in Athens, things are quiet. Only around 56% of Greeks are fully vaccinated, and infection rates remain high. The government says it might have to get tougher still to boost the vaccination rate. We first have to evaluate the data and then see where mandatory vaccination may be beneficial for other professional groups. Where gentle persuasion hasn't worked, Greece is opting for a tougher line, with ever stricter rules and penalties.
Arthur Kaplan is Director of the Division of Medical Ethics at the NYU Grossman School of Medicine. So, should the COVID vaccine be mandatory, in your opinion?
I think it should. We've tried to educate people to choose the vaccination. We've tried to incentivize them in many countries, including the U.S., with rewards, free meals, drinks, lotteries that they could win. But we still have a hardcore population here in the U.S. and around the world that's not vaccinating. And the only way out of continuing to live under the shadow of COVID is to boost those vaccination rates. I think mandates will do it.
Is it ethical to force someone to get it by law?
I think it's very ethical. People say it's my choice, it's my body, I should be able to choose. But in a pandemic, the principle is don't kill your neighbor. Don't harm vulnerable people who have immune diseases or children who can't yet be vaccinated. That's got to be the dominant ethical principle. That leads directly to the justification of mandates.
Looking at the US, what's the point of a mandate for teachers in many cases, but in most cases not for the students when you're talking about harming your neighbor?
Right. Well, in the U.S., we don't yet have approval to vaccinate under 12. So the teachers want to be protected from literally the students who might bring COVID into the classroom. The U.S. hasn't been aggressive enough, in my view, in testing so that we can't assume that people will home test and then not send their children to school. So it's very important to protect teachers, janitors, school personnel when the kids can't be vaccinated. So that's the rationale.
And what about healthcare workers? A lot of hospitals are losing much needed staff because of these new rules.
Well, look, it is a danger that people may still hold out and say, as a hospital assistant, a nurse, I'm not going to work if you make me vaccinate. I actually think the numbers are not bearing that out. We've had mandates in a number of health systems where I am in Connecticut, nearby in New York. We've lost a very few people, despite all the noise and rhetoric. They haven't quit. They don't want to become unemployed. They don't want to lose their pension. And if we push a universal mandate through in healthcare, there's nowhere else to go to work. So I think that the staff shortages maybe could be a small problem. But look, you don't want your nurse or your nurse's aide to harm you or your loved one if they're in the healthcare setting. I think you got to stick with the vaccine.
Of course not, but is it really such a small problem when we see that so much of this skepticism is among health professionals?
Well, it's a problem when health professionals don't follow the science. It's a problem when they're not good role models. Sadly, many of them are subjected to misinformation. Sadly, some of them are also worried about issues like fertility, which is not an issue for the vaccines. So, you can't let fear and misinformation drive healthcare policy. The other issue is, there's burnout in a different way. If we don't vaccinate them and our hospitals get overwhelmed, the nurses, the doctors burn out. They get tired. That leads to staff shortages too. And if they get COVID, that leads to staff shortages. So it's not sort of vaccinate and risk losing people. I think it's more accurate to say vaccinate and perhaps some people will quit, but you're not going to lose people because they get sick.
Arthur, can you tell us what the research actually says about how well vaccine mandates work?
I've done a lot of research myself on a different vaccine for the flu. We pushed that through the United States as a requirement for healthcare workers. At my own school, before we mandated flu shots, we had a vaccination rate about 77% in a very big health system. Today, it's 99.4%. Mandates will work. Employees get used to the idea that they have to vaccinate as a condition of employment. I think the protests will calm down once we institute the mandates in healthcare settings.
So is the mandate our only chance to get out of this pandemic?
Well, look, vaccination is key, but I think we've got to do a couple of other things. You do want to test, more testing, home testing, making sure, some countries are testing once a week for the unvaccinated. That's not enough. Testing is a crucial tool, and it ought to be pushed more. And hopefully we'll find some medicines that might act as preventative. Many drug companies are working on those. So if we had that 1-2 kind of combination, vaccination plus preventative medication, then I think that's the road out.
Arthur Kaplan, great to have you on the show today. Pleasure talking to you.
Thank you.
A brief look at a couple COVID stories making news, picking up on our topic today of vaccine mandates. New York hospitals have begun firing or suspending healthcare workers for defying a state order to get the COVID-19 vaccine. That's led to staff shortages, forcing some hospitals to delay elective surgery and reduce services. Lobbyists say the measures won't only hurt patients, but also affect hospital revenues. And Japanese Prime Minister Yoshihide Suga says his country is lifting a coronavirus state of emergency in all regions. The order's been in place for nearly half a year. Daily cases fell from 25,000 last month to just over 1,000 on Monday. Japan plans a gradual reopening, so some restrictions will remain in place. And lastly, let me hand you over to our science correspondent, Derek Williams, with one of your questions on the coronavirus.
Is vaccine immune response all about the levels of antibodies they induce? Or are there other factors to consider?
An antibody is a roughly Y-shaped protein produced by the body that's able to recognize and dock on to the outer surface of an invading pathogen like a virus. By docking on, the antibodies might neutralize it directly by blocking the mechanisms that allow it to invade a cell, or they might flag up the invader for destruction by other layers of the immune system's defenses. It takes some time for the immune system to learn how to tailor specific antibodies to specific pathogens. So the levels of those particular antibodies are often used as a kind of rule of thumb when it comes to judging immune status. If someone has a lot of the antibodies specific to SARS-CoV-2, then that's viewed as a sign that the person is unlikely to get a severe case of COVID-19. But it's a lot more complicated than that, because in particular, what are called B cells and T cells also play vital roles in protection, both during an infection and in immunity down the road. Antibody levels will tend to drop off in the months after infection or vaccination, experts say, because your body doesn't keep churning out antibodies to every disease you've ever been exposed to at high levels forever. That would be a waste of resources. Instead, immune system cells store long-term information on known pathogens and how to make antibodies against them. If you're exposed then again later, they recognize the invader and they can quickly ramp back up antibody production and immune defenses. In talking about immune response or a lack of it, however, we tend to focus on antibody levels because they're a fairly straightforward metric to measure. But they're really just one factor in a very complex system.
Nice to have you along. Stay safe and see you again soon. Bye-bye.